Hello, Healing Spot community. This is Justine Calderwood with the Healing Spot Physical Therapy. I'm a physical therapist who helps pregnant and postpartum moms and also women with chronic pain navigate and help them to be more active and more confident in their bodies and worry a lot less with the things that they're dealing with. So today I'm talking about how you know if your lower back pain might be a pelvic floor dysfunction. So even if you don't have pain, a lot of times pain is an indicator for people to get things looked at, and that's what drives a lot of people to seek out possibly physical therapy to begin with is their pain, but really not being able to do the things that they love and enjoy. And so that might prompt you to look into it a little bit further. But I completely lost my train of thought with the phone ringing. But anyway, so it may not be pain, is what I was going to say, that drives you to find out about possibly something going on with you. So just because you're not having pain necessarily doesn't mean that your pelvic floor is working correctly, and it may be leading to some lower back pain, okay? So I'm going to go over today just a quick screening tool that I use for people that come in with back pain. So as a physical therapist, I take into consideration like a health history. I like to talk to people to find out exactly what's going on, because that helps me to do like a differential diagnosis. But if you're at home and you're wondering if your back pain might be stemming from your pelvic floor, like the bottom where you're sitting, this is a simple tool. It's a screening tool. I have it printed out, but it was created by a physical therapist by the name of Nicole Kozian. It's called the Kozian Pelvic Dysfunction Screening Protocol. And it's just 10 questions, so I'm going to read them. If you answer yes to 3 or more of the questions that I'm going to ask or the statements that I'm going to say, then you may suspect that you have a pelvic floor dysfunction. And stay tuned until the end of this video, because I'm going to tell you what the next step is if you find out that it's possibly a pelvic floor dysfunction. So number 1 is, if you answer yes to this, I sometimes have pelvic pain in the genitals, perineum, pubic or bladder area, or pain with urination that exceeds a 3 on a 1 to 10 pain scale, with 10 being the worst pain imaginable. Number 2 is, I can remember falling onto my tailbone, lower back, or buttocks even in childhood. Number 3 is, I sometimes experience one or more of the following urinary symptoms. So there's some bullet points here. So talking about your urinary symptoms, if you ever have accidental loss of urine, so you leak occasionally, feeling unable to completely empty your bladder, having to go to the bathroom within a few minutes of a previous bathroom trip, pain or burning with urination, difficulty starting or stopping, or frequent starting and stopping of the urine stream. Number 4 is, I often or occasionally have to get up to go to the bathroom 2 or more times a night. Number 5, I sometimes have a feeling of increased pelvic pressure or the sensation of my pelvic organs slipping down or falling out. Number 6, I have a history of pain in my lower back, hip, groin, or tailbone, or have had sciatica. Number 7, I sometimes experience one or more of the following bowel symptoms. So this has to do with your bowel. Feeling unable to completely empty your bowels, losing bowel control, straining or pain with a bowel movement, difficulty initiating a bowel movement. I sometimes experience pain or discomfort with sexual activity or intercourse. Number 9 is, sexual activity increases one or more of my other symptoms. And number 10 is, prolonged sitting increases my symptoms. So again, if you answer yes to 3 or more of those statements, then there is a likelihood that you may be having a pelvic floor dysfunction versus straight up back pain, okay? And they can lead together. So what to do if you suspect that this might not just be a low back issue, and that it may be a little bit more involved, you may need some specialist care. One is, you can always reach out to me. I can help you, even if you're not local to my area. But some ways that you can find out. First, you can talk to your healthcare provider. So talk to your doctor, your midwife, your OB/GYN, and talk to them about it and the symptoms that you're experiencing, because they can help you put some of these clues together and help you understand a little bit more about why that some of these symptoms can be contributing to your back pain. One would be also seeking out help directly from a physical therapist. So most physical therapists across the United States have direct access, which means you don't necessarily have to see a primary care physician or your midwife or the OB in order to see a physical therapist. You can reach out to them directly. So reach out, find one in your area. Some great directories that I am a part of and also use that I really trust. Go to the Institute for Birth Healing. That's a great resource for people that have been trained, especially if you're a mom, okay? Pelvicguru.com, that's Tracy Scher's website, her directory, and whether you're male or female, you can find a therapist that may be able to help you on that directory. Pelvicrehab.com is another great resource in finding somebody local. And then because I am a big educator about myofascial release, even going to myofascialrelease.com and looking, there's a tab along the top that says find a therapist. So those are some great resources, ones that I personally use. If you do have further questions, you can always reach out to me. I can help direct you and get you into the care of somebody as well. I have a lot of resources across the U.S., but also international. So I'm happy to answer any questions that you have. Thanks for watching this video, and if you have any concerns, seek out help. Okay, there is help available, and somebody waiting and willing to help you out. Thank you very much. Talk to you later.